Hi everybody, my name is Chloe Kramer and I am the creator of this website. I just wanted to make a little bit of a video to walk you through my website as well as who I am personally and why I have been doing this and what I'm hoping to achieve from it. So like I said, my name is Chloe Kramer. I am a second year student at the University of South Florida. Right now I am majoring in biology with a pre-medicine focus. This is with the hopes to become a physician one day. Personally, I'm looking into OB-GYN as well as some other things like dermatology or even possibly plastic surgery. With that being said, this website kind of is a good overview and resource for those learning about the deaf community and healthcare and how more things need to be changed as far as accessibility goes, and making more things open for the deaf community, as well as making the hearing community and physicians alike aware of the struggles that occur for the deaf community on a daily basis. So with what I've learned so far in considering my school and my major, most of it has not been focused on patient care nor how we treat people. That being said, I have learned a lot about the science aspect and some of the aspects of healthcare that aren't so patient focused but more so administering care. As far as that goes, everything's very straightforward, which I feel like is the kind of the barrier between patient care with the deaf community and actually providing adequate health care. In my website, I kind of walk through that and what basic healthcare needs are as far as physical problems, mental problems, and as far as that goes, being able to communicate your issues with your physician. So what I've learned through making my website as well as providing information for you guys is that the barriers are much bigger than I feel like most people see, as well as myself included. In that case, there really are no effective healthcare services besides providing interpreters for the deaf community. Where this becomes a problem is the interpreter is now trying to give this medical advice or diagnoses to the patients without the doctor fully understanding what they are saying to their patients. Now, this not only is a lack of communication, adequate care, but it leaves not only the doctor, but the deaf patient uncertain of, okay, what is my true diagnosis? What medicine am I being prescribed? And how am I going to effectively get better? In this case, it can be frustrating for both the physician and the deaf individual or patient because, like I said, there is no effective communication, and that is one of the big things I walk through in my website. As for some other things on my website, when you start off, you see one for all for one. This is a very big part that I would like my audience to understand, but also to reiterate to myself. One for all essentially means we have a whole society. We have a group of people. We have the deaf community, hearing community, we have physicians, we have simply just patients, or we have just normal common people. Regardless of that, each and every person makes up that all. When we use one person as our example, we need to understand that that one person is needed in order to make up certain communities. When we say that, then there is all for one. If we are all advocating and using our own rights to advocate for others' rights, we can make an all-for-one contribution, meaning that this one can help for this community, but all of us can help for all the communities. In this case, this applies to the website and how we need to be advocating for our deaf community and healthcare and to get them the communication services as well as simply just their medical services they need, like normal hearing patients would receive. The first opening page kind of walks you guys through what I'm going to be acknowledging in my website and kind of goes over more in depth with sources about hearing loss, specifically in Tampa Bay, and how our community, while it is small, makes up a large deal of our Tampa Bay community and why it's important to provide for them. Then you can learn a little bit more about me. I kind of already said that for you, and how my healthcare journey is just beginning. However, I think it's important to understand that we need to learn this early down our path, because if we don't, we may not develop physicians who know how to treat patients like this, or aspire to learn ASL for these patients. Now, further in depth, the website walks you through what is hearing loss and how can we accommodate for certain illnesses that occur with hearing loss. A big thing is mental health is very vast in the deaf community, simply because there is a lack of communication between hearing. A lot of deaf people only can communicate with other deaf individuals, which kind of at times makes you feel lonely and secluded. Much as a hearing person, if there was only one hearing person, everyone else was deaf, it would be hard for each other to effectively communicate and feel included. As far as the rest of the website goes, it walks you through accessibility through telemedicine in the office, and how there are differences between children, adults, and even like young adolescents through their teenage years, and how this differs between patients and how they receive healthcare and effective communication with their physician. Additionally, it walks through solutions that may be able to solve some of these barriers talked about before. Additionally, there are resources in Tampa Bay that I can give you, as well as you can find on the website. This is just learning about how is deaf culture important to us, and what is it specifically. You can see real world examples of people talking about the lack of accessibility they have had in healthcare, as well as different services such as Tampa Bay Care, the Family Center on Deafness in the Pinellas County, and healthcare accessibility service as far as Tampa Bay Hearing goes. Additionally, nationwide services are also provided for some of my viewers who are not in the Tampa Bay area, but it's still important to understand that it is beyond Tampa Bay where these problems are occurring. Additionally, just some TED Talks and some other perspectives from a child's perspective, which I feel like was not touched upon as much in the website, but it's still important to acknowledge that the deaf community learns things from a very young age, and as they grow into their adolescence and full adulthood, that these ineffective ways and the lack of accommodations do affect how they grow up and the way they interact with their physicians. And then lastly, just providing some resources and where I did get my information from. So overall, I think aspiring to be a physician is important for myself to understand, but also be able to talk to others about how we need to provide more accessibility for our patients, especially within the deaf community. Thank you so much for interacting with my website, and I hope you learn a lot, and that you learn how to advocate for yourself as well as for others in gaining effective communication and experiences within the healthcare system. Thank you.